with the phentolamine. It's a very expensive drug. It's like, isn't it like $10 a cartridge or something like that?
17.
I think it is. I think it's pretty expensive. So, there's not a whole lot of, younger patients it may be beneficial. You give a lot of local to your kids. Do you reverse them or consider it? Or?
I don't, and the three considerations I have is, one, cost. Second, I think when kids chew their lips and chew their tongue, I think they do it right away. So I don't think that the reversal agent helps that much because they've already started doing that. The third thing is, depending on how much local anesthetic you've given, if it's a lot, if you're doing a half amount or something like that, because of the mode of action of the oral reverse, I'm wondering if there's dilatation of the blood vessels, which eliminates the local anesthetic. I'm wondering if that doesn't make the possibility of overdose worse.
Well, yeah, I asked dental students that. I said if there's, if we overdose somebody, when I talk about pediatric patients in the 4.4 milligrams per kilogram dose for lidocaine, and ask them if we overdose somebody, say you gave them local and I came in and I didn't know you gave local and I gave additional local, so we definitely overdose the patient. What can you give them? They all say Oroverse or phentolamine, and I say no, that's the exact opposite of what you want to do because it's a vasodilator, so you're going to get more of the local anesthetic back into the central nervous area and then you're circulating blood and plasma, and you're going to precipitate seizures and that kind of activity. So actually, I did talk on this previously too. You can use intralipid. You can give them intralipid, inject intralipid, intravascularly IV, and that binds circulating local anesthetics. Because local anesthetics bind to lipids, they go through the lipid nerve sheath, so it kind of puts them in a complex where it's not active, so it doesn't go to the central nervous system, and then it's broken down through the liver. So intralipid is actually the answer. But then the problem is stocking intralipid. Intralipid is expensive, and intralipid is used for patients that are in the ICU that they can't feed them, they're intubated, and what they'll do is they'll give it to them for total TPN, total parenteral nutrition, but it's an expensive drug. So they have it available in operatories where they do a lot of regional blocks because they're using high doses of local anesthetics for regional blocks, like spinals and things like that. But it's impressive, and they have resuscitated people with intralipid who have been kind of flatlined. So it's an interesting drug, but most of us aren't going to stock it. And then the Oroverse is expensive too. So I went to the Oroverse people, and I got some literature, and they said, "Give us your card." And I said, "I work in a dental school. We can't afford it. We're not going to use it." But so I told them forget about it. But they did some of the studies at Pitt. Paul Moore did some of the studies, and Debbie Student at Pitt. So.